Bismillah ar-Rahman ar-Rahim. Today we will discuss some concepts about the brain activity. As we learned previously, you know that the cerebral activity is actually under the control of the reticular formation in the brain stem mainly, which means that the driving or the activating system of the brain is the reticular formation. These signals will come from the reticular formation, more specifically the excitatory area, reticular excitatory area, or it's called bulboreticular excitatory area. It will send fibers to the cerebral cortex to activate it, but it will be through the thalamus, and it will be of two types, either through slow conducting small fibers, that's non-specific, pass through non-specific nuclei of the thalamus. You know that nucleus is the intralaminar nucleus, for example. And additionally, it can send signals to a specific regions in the cerebral cortex, and that will be through the fast conducting fiber, but it will be of short duration and to specific areas only in the cerebral cortex. However, the other one is non-specific. It's a diffuse that control the electrical activity of the cerebral cortex. And also these reticular signals will also send signals to the spinal cord, because it needs to control also the tone, especially of the anti-gravity muscles. Therefore, this is an important structure called the excitatory area, reticular excitatory area. So what control this what determine the level of activity in this excitatory area? Actually, it's mainly the sensory inputs to this area, like visual stimulus can activate this area, auditory stimulus, different tactile stimulation, and especially pain. Pain is the main driver to activate this system. So, for example, when you have pain, there is no way for you to sleep. You are always alert and attentive until this problem is solved. Additionally, the positive feedback, the back signals from the cerebral cortex to this excitatory area, also it acts as a positive feedback to increase the level of activity in this area. There is also what we call it the inhibitory area. The reticular inhibitory area is lower in the brainstem, and it acts first through certain inhibitory neurotransmitter to sort of inhibit this activity in this excitatory area, which we need every now and then, especially during sleep, so to decrease the activity in the brain. So we talked about the first system that controls brain activity, which is direct neuronal pathways. There is another kind of system that controls the brain activity, which is the neurohormonal system. It's actually by releasing certain neurotransmitters from different areas in the central nervous system, especially in the brainstem. For example, in the nucleus of Raphe or Raphe nuclei, it releases serotonin, and serotonin acts mainly as an inhibitory neurotransmitter, which is especially important in the pain pathway to suppress pain and induce sleep. For example, the gigantocellular neurons of the reticular formation, they release mainly acetylcholine, which acts mainly as an excitatory neurotransmitter to increase the wakefulness of the brain. You learned also about substantia nigra that release dopamine to different areas in the brain, not only to the basal nuclei as we learned before, to the caudate and putamen, but it also can send signals to the hypothalamus and the limbic system. So the dopamine here, it acts both as an inhibitory, excitatory, depending on the receptors that are in that specific area. So again, these different areas release different neurotransmitters, and depending on that specific receptor in that area of the central nervous system will act as either inhibitory or excitatory signals to the activity. Sleep is a reversible state of unconsciousness that the person can be aroused from by sensory stimuli, unlike the coma, which most likely will not be aroused. Sleep is divided into two types: rapid eye movement and slow wave sleep. During each night, every person will go through different stages of these two types of sleep, the REM and the non-REM sleep. Most of the duration of the sleep is slow wave or non-REM, while about 1/4 of the duration is REM sleep, and it's about bouts that last from 5 to 30 minutes. The duration is different during this sleep period. For example, if you are very tired during the beginning of the sleep, these bouts of REM sleep will be very short and may be absent. And as you get more restful during the night, these bouts get longer because the REM sleep is a sort of an active sleep. It's not a restful sleep. And these bouts will kind of recur almost every 90 minutes. REM sleep is called paradoxical sleep because the brain will be in an active state and the metabolism increased by 20%. However, the person is unaware of the surroundings. The person usually is in a state of dreaming during this type of sleep. That's why there is rapid eye movement kind of thing in this sleep, associated with maybe involuntary movements in different muscles in the body. However, in general, the muscle tone is decreased, is depressed in the body. It's also associated with irregularities in the heart rate, respiratory rate, and the person will be difficult to be aroused from this type of sleep. So the other type of sleep is slow wave or non-REM sleep. This is the kind of deep, restful kind of sleep that you get during the night, especially in the first hour, and it's associated with decrease in different vegetative functions in the body, decrease in peripheral vascular tone, decrease in blood pressure, respiratory rate, and metabolic rate. This type of sleep is also associated with dreams. It's not a dreamless type of sleep, but the difference is most likely you will not remember the dreams in this slow wave because there is no consolidation of memory, and maybe it's less associated with muscle activity. Now, sleep in general is not well understood yet. There are so many theories trying to explain it. However, none of them yet explain the whole mechanism of sleep and the importance of sleep. There are many nuclei that play a major role in sleep, such as the Raphe nuclei, reticular formation in nuclei, nucleus tractus solitarius, and nuclei in the hypothalamus. And many neurotransmitters may play a role in the sleep. And all of us will know that sleep is very important, but we don't know exactly the functions or the specific physiological functions of sleep. So electrical recordings from the outer surface of the head, or what we call it electroencephalography, it shows continuous electrical activity in the brain. And these waves will differ in intensity and pattern according to the level of excitation. For example, the state of wakefulness compared to sleep state, compared to certain diseases such as seizures, they will have different intensities and patterns of these waves. In general, healthy adults will have waves in the EEG classified as alpha, beta, theta, and delta waves. So a discharge of a single neuron or a bunch of neurons will not be recorded from the surface of the head. Therefore, you need like a summation of thousands to millions of neurons that will fire synchronously in order for these waves to be recorded from the skull.
So therefore, this electrical activity that's recorded by the EEG reflects the number of neurons that fire synchronously, not the total number of neurons that are active. For example, in this example, when the eyes were closed, you can see this electrical activity in the form of alpha waves. However, when the eyes opened, now there is increase in the electrical activity, but in an asynchronous fashion. This asynchronization will kind of nullify each other. That's why the recorded will be like a beta waves here. And when the eyes closed again, you can see again the appearance of the alpha wave. So electrical activity recordings reflects the degree of synchronization, not the total degree of activity of the neurons. In young adults, brain waves are divided mainly into 4 types: alpha, beta, theta, and delta. Alpha waves are mainly present during awake, restful state of cerebration. Once there is deep sleep, these alpha waves will disappear. And if there is any specific mental activity, especially in the occipital lobe, as the example that we showed before, about just opening the eyes, these alpha wave will be converted into beta waves of lower voltage waves. These beta waves reflect specific mental activity. Now, the theta waves are present in children, but also in person with strong emotional stress, frustration, or disappointment. You can see these theta waves. The delta waves are shown mainly during the deep sleep or serious brain disorders, or maybe in the infancy. So we can see here the EEG patterns of different stages of wakefulness and sleep. For example, you can see here in the quiet wakefulness stage, the alpha waves, whereas when there is alert wakefulness, it will be converted into beta waves. We said that's because of the desynchronization in the waves, which is very similar to what happens during the REM sleep, on what we call it paradoxic, because we said it's kind of similar to the state of active wakefulness. However, the person is not aware of the surroundings. You can see also the desynchronization that's taking place because of the increasing the activity. Now, when we go to the stages of the slow wave sleep or the non-REM sleep, stage 1 is characterized by kind of spikes or spindles of alpha-like waves here, and then a large state of decreased voltage or the activity. Whereas in stage 2 and 3 and 4, there is a decrease in the frequency of the waves, and we can see here the typical delta waves in the deep type of sleep. Neuronal activity can get excessive and uncontrolled, leading to disruptions of the brain function. And this disruption is temporarily, so we call it seizures. And if we know the cause or the underlying mechanism for that, it can be treatable, then these seizures will go away. For example, if there is electrolyte imbalance and we correct this thing, there is hypoglycemia, if it's caused by drugs or maybe by infections, if you treat the underlying condition, then these kind of seizures will go away. However, if these seizures are recurrent and this condition become chronic, then we call it epilepsy. And epilepsy has a wide range of presentations of symptoms, from like temporarily kind of thing into convulsions, and this reflects different pathophysiological mechanisms. Epileptic seizures can be classified into two types, either partial seizures or focal seizures, that's localized area in one of the cerebral hemisphere, or generalized seizures, which are diffuse throughout the hemispheres of the cerebral cortices. Focal seizures in general can result from localized causes, such as scarring in the tissue of the brain, or maybe a tumor compressing on that part of the brain. So these partial seizures can be either simple or complex. They can be preceded by an aura, like kind of sensation, maybe a fear sensation, whatever, followed by these types of seizures. They may involve impairment in the consciousness or may not. The time after the seizure and before the patient gets back to normal neurological function, we call it post-ictal period. Now, generalized type of seizures, they are characterized by excessive, diffused, uncontrolled neuronal discharges that are transmitted rapidly to both hemispheres. So the first type of the generalized seizures is called generalized tonic-clonic seizures, or what's called grand mal seizures. These are characterized by being an abrupt onset of loss of consciousness associated with the neurological symptoms. Mainly there is a tonic seizures, increase in the generalized tone, followed by spasmodic muscle contraction, hence the name tonic-clonic seizures. Most of these seizures are idiopathic, however they can be triggered by certain epileptogenic factors such as strong emotional stimuli, alkalosis, fever, certain drugs, certain increase in the sensation, visual or auditory sensations. These patients may bite or swallow their tongues, resulting in cyanosis, so you have to protect these patients. And these kind of seizures will last from seconds into up to like 5 minutes. And these seizures will be followed by post-ictal state of generalized depression. So they want to kind of sleep and get more rest. The other type of generalized seizure is called absence seizures or petit mal seizure. This type of seizure starts usually in the childhood or early adolescence, and it's very tricky for diagnosis. These types of seizures associated with either unconsciousness or diminished consciousness with certain types of twitch-like contraction. For example, these patients can just stare and then do some type of like blinking of the eyes for a few seconds, and they will return to the normal activity. So the pediatrician or even the family, the mother should be careful in noticing this kind of thing, refer it to the neurologist. That's it for today. Thank you.